Hi, my name is Tamra and I'm interviewing Alla today, who works for Quest Diagnostics. So Alla, can you tell us a little your job title?
I am the senior group lead at Quest Diagnostics.
And how long have you been in this career?
I've been at it since 97, over 20 years.
And can you tell us a little bit about what you do?
Basically, it's a clinical laboratories. My department is molecular infectious disease. So I'm part of the transplant team and the COVID team this past year. So we monitor the patients and we test people's bloods, CSF, cerebral spinal fluid, urine, ticks, stool, that's poop, in case you don't know. So that the doctors' offices and the hospitals send to us.
And when you were in high school, did you know what you wanted to do?
I actually wanted to be a doctor. Life happens. Every day everybody has different paths to take. They see something, but other things come up. So then I just kind of got into being a medical technologist through the help of my uncle and my mom. Actually, they introduced me to LabCorp, which is another clinical laboratory. And then I switched to Quest and got into infectious disease, and I've been there now for 20 years.
Wow. And what education did you need to get into that field?
Honestly, you just really need a chemistry or a biology degree to be a medical technologist. Or actually, there is also a course you can take at Nova. Even our company Quest offers you courses to become a medical technologist. In state of Virginia, you don't have to be board certified to be a medical technologist, but you do need certification to work at hospitals and doctors' offices in Virginia, and other states also require, like New York, Tennessee, Atlanta, Georgia, Georgia, California, they have also their own certification that you need. But working at Quest right now, I'm working under the medical director's certification.
And what kinds of machines or equipment or tools do you use at your job?
Well, we have biofume hoods, we have centrifuges, we have, to be honest, we've had equipment that came from Great Britain and was shipped for COVID from overseas. They're huge, they're the size of, could be the size of a room, a bedroom, and then we fit equipment in it. So we have several different kinds, I guess.
Can you tell me what your average day looks like?
So as a lead, my average day has kind of changed because of the pandemic, but usually, I used to lead a team of 20. The pandemic changed it, made it to be leading 60 people on 3 different shifts. Quest is a 24-hour laboratory, so I have people working there all hours. I myself during the pandemic worked from 4 a.m. to almost 8 p.m. 12, 14-hour days. But typically I start at 4 a.m. and I go till 12:30. I get in there, make sure everything from the night before was good, and then assign people to the tasks that they need to do. And then if I need to get onto a bench and do some testing, because if I have a person out, then I would do that too. And then my supervisor would comes in at 7, and my manager at 7 or 8 a.m. and then we just discuss other daily routines or other problems that are going to come up, basically.
What is something that you like and dislike about your position?
What I like the most is that at the end of the day, when we get those results out, it gives me a sense of accomplishment. For example, just because everybody's really familiar now with the COVID pandemic, in the beginning last year, this time March, we were just so overwhelmed because we had so much testing. But As we, we hired more people, we got more equipment. Now, now that we're so organized, when those samples come in and we can turn around and give the results back to the patients, to the doctors within 24 hours, so they know they're okay, their families are okay. It's a good sense of feeling. What I don't like, I mean, I love my job, but I guess sometimes I don't like politics. I mean, politics is everywhere, even in the workplace. I don't like reprimanding people, but sometimes you gotta do that. So, but other than that, I like my job.
If you were gonna hire somebody, what would you be looking for?
Well, we gotta first and foremost is the level of education, because you can't just, we cannot just hire you, for our department. We gotta see what you have studied in school, and what your background is, if you have a science background and so forth, if you have a certification or not. Other than that, knowing what the person's goals are, their references, how do they look on their previous jobs, if they had any, and the way they just interview is the key, is the first impressions and what they say at those interview questions. That's the most important. And also, really, as a whole, Quest is not just about the clinical laboratory. I mean, you don't have to have a science. You do have the science. You do need that science background to work inside the laboratory, but overall, just working, you can be a lawyer, you can be a financier, you can be an IT guy, and still work for Quest Diagnostics, because you still need all those departments to mesh to give you the whole company.
Okay, well, those are all of my questions for today, so thank you very much.
Thank you for having me.